everyone. Welcome back to Medical Mondays. I'm Jessica Hill. I'm the Director of Nursing here at Southeastern Community College and wanted to welcome you back for a brand new Medical Monday that we have filmed for the month of November. We are going to be talking about diabetes awareness. November is Diabetes Awareness Month, so we thought what better time than to share our nursing knowledge with you. Diabetes is a very common disease. There are over 37 million Americans that are diagnosed with diabetes, and that includes both adults and children. In healthcare, there are what we consider three really main types of diabetes. We have type 1, type 2, and then gestational diabetes. So I'll go into a little detail about those three types. Type 1 diabetes is most commonly diagnosed in children. This means that your body does not produce insulin, and insulin is what our bodies need to break down blood glucose. When you don't have enough insulin or your body can't use it appropriately, your blood sugar increases. So in type 1 diabetes, these individuals do not make insulin. So they are what we title insulin dependent diabetics. That means they have to have insulin medication to control their blood sugar. The second type of diabetes, and probably the most common type of diabetes, and it's probably what many people think about when they are thinking about someone with diabetes, they're probably thinking about someone who has type 2 diabetes. Mainly, this type of diabetes is diagnosed in adults, in the adult population. These individuals are what we consider insulin resistant. So their bodies produce insulin, but their bodies just don't use that insulin well to decrease blood sugar levels or to control blood sugar levels, so their blood sugar levels get out of control. Gestational diabetes happens in women who are pregnant. We won't go into much detail about gestational diabetes today. Let's check in with our nursing students, and they're going to tell us a little more about blood sugar checks and insulin and why those things are important if you are a diabetic.
Good morning.
Good morning.
How are you feeling today?
I'm a little tired.
A little tired. Okay, well, I'm just here to check your blood sugar this morning. Do you do that at home any?
No, not really.
Okay, well, I'll just walk you through the steps of how we're going to do it, and I'll just teach you a little, okay?
Okay.
All right.
Are you going to prick me with the needle?
So it's just a little tiny needle. It's going to feel like just a pinch on your finger, but it'll be over in just a second.
Okay, I'm not a fan of needles.
Oh, yeah. Well, if you want to just look that way and don't watch me do it, and I'll just talk you through it.
Okay, that sounds good.
Alrighty. So we're just going to pull this back. Oh, I see you have some candy bars in here and Skittles.
Yeah, just a couple of little snacks when I get hungry.
Yeah, so, because you're a diabetic, we kind of need to avoid things like this.
Oh, man. So I have to make a lot of changes with this new diagnosis.
Yes, ma'am. This is going to send your sugar up really high and can damage your body, and we don't want that to happen to you.
Okay.
Alrighty. So, what I have here is just my machine. And then I have my strips that'll go into the machine to check your sugar. And then just our little finger prick, okay?
Okay.
Alrighty. Just turning it on right now. Alright. We're just going to put our strips in. And this kind of looks like the machine that you'll be using at home, okay?
Okay.
Alright. Okay. Now it's very important that you always use an alcohol swab and you clean off the finger that you're going to use, okay?
Okay.
So which finger?
We can go with this one.
Okay. So you can prick your finger either in the middle or on the side, but a lot of times they find that on the side hurts less.
Okay.
All right. So now that it's dry, we're just going to put this, and it's going to be a little prick on 3. 1, 2, 3. All right, good job. We're just going to get some blood on here. All righty. We're waiting for your number to load. Okay.
What is it?
Your sugar is 315.
Oh, wow. Is that good or bad?
That's really high. We want it to be between 70 and 110. That's where we know that everything's okay, your diet's under control, and your sugar's not really high. But right now with this 315 reading, it's very high. So what we're going to do is give you some insulin for coverage.
What is insulin?
So insulin's going to help the blood sugar get into your body cells so that your body can use that for energy.
Okay.
All right.
Is it going to help bring my sugar down?
Yeah, it'll bring your sugar down to where we need it in that range of 70 to 110.
Okay.
All
Sounds
right.
good.
So have you never administered insulin to yourself?
No. Is it going to be another needle?
Yes, unfortunately it is another needle, but it's a small one as well, just a little bigger than what we just worked with, and I'll just show you that before, okay?
Okay.
All right. So what we have here is our insulin,
Okay.
and our insulin needle, and our alcohol swab. So this is what we call a subcutaneous injection. So we're going to give it into areas such as your abdomen or the back of your arm. Which would you prefer?
My abdomen.
Okay. So what I'm going to do is open my alcohol and swab the top of my vial for at least 15 seconds.
Okay.
All right. So now, remove the cap. And so we're going to give you 10 units of insulin.
Okay.
So I'll show you here that we're going to pull back to 10. You see that it's at 10?
Yeah.
All right. So then we're going to take that and inject it into our insulin vial and just press that air in.
Okay.
So then you flip it up and you pull back to 10. All right. And making sure there's no air bubbles. All right, so I'm just going to slide mine cap back on. All right, and we're going to set that here. So now, you're going to take another alcohol swab and alcohol the site where you're going to give the injection.
Okay. Ooh, that's cold.
Oh yeah. So just another 15 seconds, and make sure that it's dry whenever you finish.
Okay.
All right. So now you remove the cap, and so for this kind of injection you want to make sure that you pinch the skin up.
Okay.
So we're just going to pinch up, and then we're going to inject on 3. 1, 2, 3. All right, we're going to hold that there for about 5 to 10 seconds to make sure it stays in. All righty.
That wasn't too bad.
Nah, not too bad. All righty. Well, and I see you have a cheeseburger and french fries over there. When dinner comes around, let's try to make some more choices, such as like a grilled chicken sandwich and some greens for your side, okay?
So I can't eat a burger and fries anymore?
Well, that wouldn't be the best choice for you now that you know that you're diabetic and your sugar's kind of high, so we want to make sure we regulate that and get that back under control with healthy diet, okay?
Okay.
There are many different types of complications that come along with diabetes. If you are a diabetic, it's important to control your disease very well and to keep your blood sugars under tight control as possible, whether that be as a result of taking medication and or just diet and exercise. It really is very individualized. Complications can include things such as eye damage that even lead to blindness, kidney damage, nerve damage, heart disease and stroke, gum disease and dental problems. Diabetes can even affect your sexual health, and you can end up with bladder problems, and it's even linked to some types of cancer. It is a disease that can affect almost every part of your body, so it's very important to keep your disease under control in conjunction with your healthcare provider. There are many risks that are associated with the development of diabetes. If you have a strong family history, you really need to pay close attention to your health because likely you are predisposed to becoming diabetic. If you are overweight or obese, this is one of the main risk factors of becoming a diabetic. Individuals who are 35 or older are also at an increased risk of developing diabetes, specifically type 2 diabetes. And individuals who are not very physically active. All of these things contribute to your risk of developing diabetes. As I mentioned earlier, diabetics can have many different types of complications. One of those can affect your nerve system. Diabetics often get something that we call peripheral neuropathy, which is just a fancy way of saying that they don't feel things the same way that someone without diabetes may feel, specifically in their hands and their feet. Foot care becomes an extremely important part of your daily routine if you are a diabetic. Because if you have out of control blood sugars and you end up with a wound on your foot or you hurt your feet in some way, those sores or wounds are less likely to heal appropriately whenever you have diabetes. So let's join our nursing students for a little skit around foot care.
Hello.
Good morning.
How are you doing?
I'm good. How are you?
I'm doing okay. I can't complain. So I just want to check with you, and what's your name and date of birth?
My name is Samantha Smith, and I was born 2/12/81.
Okay. Miss Smith, what brought you in to see me today?
Well, I've started to notice this wound develop on my foot, and I'm not really sure what's causing it, and I was just wondering if you could take a look at it and tell me what you think.
Sure. So what do you think caused that wound?
Well, my shoes have been feeling a little bit tighter than they usually do.
Okay.
I'm thinking maybe that could be a reason.
Okay. Yeah, I'll definitely take a look here. So I have a question. I'm going to do a few questions, and I'm going to teach you as well as I go along, okay? So do you happen to buy your shoes in the morning time or the afternoon?
I usually buy my shoes in the morning.
Okay. And is this tender to touch?
It's tender.
Okay, so what I think happened is maybe with your shoes being bought in the morning and you saying them being too tight, that rubbed a little sore on your foot. Okay. So I want to teach you to buy your shoes in the afternoon. And the reason why I say that is because in the afternoon, our ankles and our feet tend to swell. So when you're buying shoes in the afternoon, you're buying a bigger size. So it's going to prevent them being too small, and it's going to prevent them from rubbing and causing any type of skin tear or wound on your feet, okay?
Okay.
So the next thing I want you to do is I want to teach you to inspect your feet every day. And this is really important because you might be out and about and step on something and might not even feel it. Mm-hmm. So with you inspecting it, you're looking for any redness or any irritation or any wounds to prevent wounds, okay? And another thing I would like to teach you is, when we get out the shower, we all like to put lotion on and smell really good. Mm-hmm. Just make sure that we're not putting lotion in between these toes, okay? And then the other thing I would like to teach you today is to always wear shoes. This is important too because it goes back to inspecting our feet every day. If we could step on something and we not know it, wearing shoes, you're less likely to do that. So when you get out of bed in the morning, just slide you some slippers on throughout your house. Okay. And that's going to keep us from preventing anything that we have already had like this. Okay? So do you have any questions for me today?
Yes, I do have one question. Since I'm not able to trim my toenails myself, who would be the best person to help me with that?
Okay, that is a really good question. So I am going to refer you to a podiatrist. We either want a nurse or a podiatrist to trim your toenails. And we have a podiatrist here in Whiteville. He does a really good job. And we'll get that taken care of for you, and I can put you in a referral to him. And I also am going to put you in a referral to the wound clinic. Okay, and we're going to get this wound taken care of. Sometimes with diabetics, they have a slow wound healing.
Okay.
So hopefully we'll get you in with him and get this wound towards the healing stages, okay?
Okay, that sounds good.
Okay, is there anything else I can do for you today?
I think that's it.
Okay, have a good one.
Thank you.
Symptoms of diabetes include things like increased thirst and urination, feeling tired without being able to get enough sleep to feel like you are catching up, and an unexplained weight loss. There are other symptoms of diabetes as well, but these tend to be some of the main signs and symptoms that people do ignore and or maybe do not associate with diabetes. There are many people who have diabetes that don't even realize they do have diabetes because some of the signs and symptoms can be so subtle that you don't realize that you have a problem until things get very out of control. Individuals with diabetes need to make sure that they manage their lab results. So things such as hemoglobin A1C, which is a lab that tells us what our blood sugar has been over about a 3-month period. That helps give your healthcare professional a good idea of how well you are managing your blood sugar, how tightly it's controlled. So keeping that in a good range if you have diabetes is very important and helps lessen the risk that you develop additional complications along the way as you progress. Also, it's very important to manage your blood pressure and your cholesterol levels. Be prepared for the visits with your healthcare team. Write down questions that you think of between appointments. Keep a log of your blood sugar results every day based on how your healthcare provider has asked you to keep track of that. So making sure that you participate in your care is very important when you are a diabetic. Also, seek additional support for your individualized situation. If you're experiencing other issues that are associated with your diagnosis of diabetes, such as you may be having blurred vision and or you may have some kidney problems, make sure that you build a team of healthcare professionals that can enhance your overall health. Make physical activity an important part of your day, and if you cannot physically exercise every day, then do that most days of the week. More is better than none. Follow a diabetes meal plan. There are plenty of resources to help you understand what are the important foods to avoid and things that are okay to include in your diet. Some foods affect certain people's blood sugar in a different way than it does someone else. So also realizing what types of food affect your blood sugar the most and avoiding those is very important as well. And then stay on top of your vaccinations. When diabetics get sick, it stresses their body out and they tend to have an increase in their blood sugar. Also, diabetics tend to heal less quickly. So making sure you stay healthy is extremely important. Even a support group can be helpful for individuals trying to manage their lifestyle while living with diabetes.
Good afternoon. My name is Talisha. I'm going to be your nurse educator today. And I want to thank you all for coming in to take control over your health. I have some packets here. Just take one and pass them around, please. Okay, so we're going to start off talking about what is diabetes. So diabetes affects how the body turns food into energy. Can anybody tell me some foods to avoid?
Maybe a cookie?
Yeah.
So I can't have oatmeal cake or raisin cake?
That's not best, but let's think about some food options that are beneficial. Anybody got any ideas?
I would probably say popcorn and maybe like veggies?
Absolutely, those are some good choices.
So like cucumbers and stuff? Or
Yes.
just a healthy snack?
Yes, absolutely. So some other things you might want to consider, you want to increase your water intake, avoid excessive amounts of sugar, saturated fats, and a lot of carbs. Other preventative measures that would be great for you would to be stop smoking or any tobacco use. Does anybody in here smoke?
No, but I know somebody that doesn't has diabetes, so maybe I should tell them they need to stop.
Yeah, that would be good. It will be good to help educate people in the community. So some things that diabetes affects is the body system. So I have some examples here. So diabetes affects the brain, the heart, the eyes, the kidneys, and the nerves, and also the feet. So if you guys want to take a look at these after class, that would be great. Are there any complications that anybody else is experiencing here today with diabetes?
Well, I do notice that like real late in the night, like I'm just so tired the next day because I stay up all day or all night peeing. Is that a complication of
It
diabetes?
is a complication. Also with like frequent, like being hungry all the time and super thirsty. Those could be some things. That's why you want to increase the water intake.
Okay.
Also, with the complications with the body, you also want to exercise. So you can do weekly, maybe 3 times a week, depending on your health. You can do 30 minutes or longer of exercise. This is to maintain a healthy weight, and that's important when you're dealing with diabetes. So lastly, the most important thing to remember is to take your medication. So if you're taking pills or you're having to give yourself insulin, we can always provide you with additional classes to teach you how to administer insulin to yourself. You also want to monitor your blood sugar. So everybody gets a take home glucometer to check your sugar at home. And it's also important to know all the signs and symptoms. And that's why I passed out these packets to you all, so you have the information to take home. You have contact numbers. You can always contact the Columbus County Health Department, or there's also a diabetes education, additional education at the Columbus Regional Medical Center. Is there any other questions I can do for you guys here today, or is that it?
So, diet, exercise, checking my sugar, and making sure I'm taking my medications can all keep this under control for me?
Absolutely, and also teach your friends out there who are smoking to stop smoking.
This is a nice little handout that I can also refer to my friends about
Absolutely.
the signs and symptoms of diabetes.
Absolutely.
Thank you for joining us for this month's Medical Monday. We talked about diabetes awareness for the month of November, and we shared some information with you in today's episode. If you are worried about yourself or you're worried about a family member, there are plenty of resources in Columbus County for you. You can reach out to your primary health care provider. You can reach out to the Columbus County Health Department, and Columbus Regional Healthcare System even has a diabetes education program. The key is be an advocate for your own care. And if you are questionable or if you are worried, catch things early and start your healing process as quick as possible to prevent any complications. So again, thank you for joining us for Medical Monday. Thank you to our second-year associate degree nursing students for participating in this month's filming of Medical Monday, and stay tuned for what we bring you next month. Again, I'm Jessica Hill, the Director of Nursing here at Southeastern Community College, your host for Medical Monday. Stay well.